Hello, this is Dr. John Staley, president of your Home Team Care. We're hoping everybody's going to have a great April. And one of the marketing opportunities we have this year in our company, and we do every day, is working with families that are afflicted by certain disease states. And one of the fastest growing disease states being recognized across the United States is Parkinson's disease. My father, we were fortunate to start this company because of him. He also had Parkinson's late in his life. And there are certain signs and symptoms, since this is Parkinson's Disease Awareness Month, that afflict the elders as they get older. First of all, when you're looking for Parkinson's in a patient, you want to look at pill rolling. There is a sign of fingers that they're in their hands where they have this kind of, when they move their hands, it'll be a pill roll effect. That's one of the first signs and symptoms of Parkinson's. Secondly is their gait. They go into what's called a shuffle, where instead of taking a crisp step, they start shuffling their feet, and that's another telltale sign. Thirdly is the flat effect that comes across their face a little bit. It appears their eyes are not as clear. They're sort of a cloudy look. Oftentimes we see this in dementia, and dementia can occur in Parkinson's patients also. Finally is their gait. There's sort of a loss of balance. So all these are signs and symptoms of Parkinson. As a son or daughter, as you're looking for your elder, you also want to see about their appetite. Sometimes in Parkinson's patients, their appetite sort of decreases, but there becomes a change. Parkinson's affliction, certainly there's a lot of medications and certain electronic stimuli that now can be put into patients to help them with the slow down the disease or retard the disease process. But it is something that requires eventually home personal care. We believe that our company, which is nursing physician managed, are able to assess these and prevent these kind of falls, which often afflict Parkinson's and other patients. And when people fall, they fracture hips. And that's one of the things that leads to the demise of the elder, is loss of strength, loss of fractures. And we'll talk about stress, which occurs with them internally, which makes them a little bit more scared to be walking, and therefore they lose muscle control, and there's a whole cascade of events that are not great for the elders when they occur with this disease. So one of our company's hallmarks is we work with TJ Parkinson's Foundation and other foundations here in town, and we are very aware of the importance of supporting these. We just finished with a huge fundraiser for the Parkinson's Disease Foundation here in Knoxville. And that's one of the things we try to do to contribute to the community, as also to help the elders, which is what we are designed to do in your home team care, is to give you peace of mind. And that's what our company does. So this is Parkinson's Awareness Month. I would look, if you're a son or daughter or family member, to look at your elder, mother or daddy, and see where they're progressing in this.